childbirth is a unique moment in every woman's life. It represents the end of a long journey that lasted 9 months and the beginning of a bond for life. In the last video, which you can find by clicking here above, we have seen in detail what happens during childbirth. But what about from the point of view of the newborn, who opens his eyes for the first time? We cannot ask a child what he feels or remembers when he was born, but some things can be reasonably hypothesized. Some scientists have tried to calculate roughly the probability of birth, that is the probability that just that sperm fertilized that egg to give you life. There is talk of one probability in 400 million billion about the number of cubic meters of the Atlantic Ocean. A series of incredible combinations of odds led to your birth, making you so special. Congratulations! We talked about what happens to the body when you die and about the various cadaveric phenomena which manifest themselves over the hours, months, and years, and what happens when you are born instead. As soon as you see the light, after 9 months of complete darkness, you will let yourself go to a liberating cry. It is an actual response of the body to begin to breathe, as well as an attempt to adapt to that sudden change in the surrounding environment. Your lungs fill with air seconds after giving birth, allowing you to take your first all-important breath. The alveoli expand and allow oxygen to pass through. This way, you will finally practice those breathing movements you learned while immersed in amniotic fluid. Your hands and feet may appear blue due to the low oxygen saturation in the body. Your blood vessels are still very small, and it takes some time for the blood to circulate properly. As the minutes pass, the circulatory system will begin to function properly, and your skin color becomes more intense. Your vision is blurred, and the world around you appears as if you were looking through the lens of a dirty camera. The maximum focusing distance is 20-30 centimeters, which is enough to observe the features of mom and dad. You can perceive the difference between light and dark, but it is difficult for you to distinguish one object from another because you have not yet developed depth perception. You will begin to use all of your senses to try to understand what is happening around you. Your head may be slightly pointed due to passing through the birth canal, but this is only temporary. Within a few days, your head will take on a rounded appearance. You will continue to keep your legs and arms bent because you have been used to that position in the womb for a full 9 months. It's a matter of time, and your limbs will straighten. To immediately establish the first skin-to-skin contact, you are placed on your mother's chest. Maternal warmth will warm you, keeping your body temperature constant. After 1-3 minutes, the umbilical cord that tied you to your mother for 9 months is clamped and cut. In this way, you will have a stump left, which will fall in the following days, thus forming the navel. You could recognize the voice of the mother and father because they already seem familiar to you, since you have heard them for 9 months inside the mother's womb. After 1 minute, you are already subjected to your first test, which is not of skill or intelligence. This is the Apgar test, which allows you to measure your reactivity and vital signs, thus evaluating your reaction to childbirth. The Apgar test is based on the observation of 5 parameters: heart rate, breathing, muscle tone, reflexes, and skin tone. A score will be assigned to each parameter, ranging from 0 to 2, and then added. The highest score you can get on the test is 10. A score of 7 to 10 is given to infants who appear healthy and do not require further assistance. A score below 7 may indicate that the infant is in need of pediatric care or neonatal intensive care. The Apgar test is a simple assessment of the newborn baby's well-being and does not predict your future health. It will then be repeated 5 minutes after birth in order to assess your adaptation to life outside the womb. You will then undergo a physical exam. You will be weighed, and they will measure your length and head circumference. If everything is okay, you can go back to your mom. You will be given the first puncture of your life, as you will be given a dose of vitamin K to prevent bleeding in your first week of life. Vitamin K plays a vital role in the blood clotting mechanism, as well as maintaining healthy bones. It's time to rinse quickly in order to remove any residue. Your skin is covered with vernix, a waxy white substance that protected you as you developed in the womb. It is made up of 80% water, 10% proteins, and 10% lipids. The actual bath tends to be postponed to avoid removing the vernix and waiting for it to reabsorb naturally in the next few days. Your skin will remain so soft and hydrated. So it's time for your first snack. You will be attached to the mother's breast to receive colostrum, a thick liquid rich in immunoglobulins and amino acids, which will help build your immune system. It will be your only food you will need for the next few days. Colostrum gradually transforms, first into transition milk and later into mature milk, which contains everything you need for optimal growth during your first 6 months of life. At this point, a few days after your birth, if you and your mother are fine, you can leave the hospital and finally go home, where a whole world awaits you to discover, made of colors, lights, and shadows, which will paint the canvas of your life. Does the baby feel pain during birth? Obviously, children cannot tell us their experience of pain, and it is difficult to deduce it from a simple visual observation. Until recently, researchers assumed that newborns did not have fully developed pain receptors, but according to a 2015 study published in the journal Time and led by researchers at the University of Oxford, things would be a little different. The study looked at 10 infants between the ages of 1 and 6 days and 10 adults between the ages of 23 and 36. The infants were placed in a magnetic resonance imaging scanner, where they then fell asleep after a short time. Meanwhile, they were poked on the bottom of their feet with a kind of pencil with a stimulus mild enough not to wake them. Meanwhile, brain scans were analyzed and then compared with brain scans of adults, subsequently exposed to the same pain stimulus. The researchers found that 18 of the 20 active brain regions in adults experiencing pain were also active in infants. Furthermore, the scans showed that the brains of infants had the same response to a weak blow as that of adults exposed to a stimulus 4 times stronger. The study results suggest that not only do infants experience pain similar to adults, they also have a much lower pain threshold. However, the extent to which they hear it is still questionable. The newborn's brain is still immature and has yet to learn to distinguish the different stimuli. But the good news is that if being born hurts, you won't remember it afterwards.